We really have to find ways with which to spread the pain, but also spread the benefit. If we get universal coverage, real cost containment, improvement in quality, and changing the paradigm from illness to wellness, it may be worth taking that pain pill to accommodate what we have to do in the early years to put that new infrastructure in place.
That was former Senate Majority Leader Tom Daschle talking to Bloomberg's Peter Cook about how to pay for health care reform. He says one way is to tax some employer-provided benefits. Our discussion on health care reform continues now. We are pleased to welcome Dr. Robert Glassman. He's a private equity partner at OrbiMed Advisors, the world's largest health care dedicated investment firm with approximately $5 billion in assets under management. Dr. Glassman is also a clinical professor of medicine at Weill Cornell Medical College. He says, as a physician, he's fearful that policymakers crafting the health care plan will overlook a key element of quality, which is innovation. And we are also pleased to welcome Bloomberg's Mike Waldholz, managing editor of our health team. Gentlemen, I want to try and get the discussion going with another point that former Senate Majority Leader Tom Daschle made, which is we're going to eventually have to come to a compromise. Now, the question I have for you is, if we compromise and if it's left up to Congress, are we going to get something even worse than what the president put on the table?
Well, I'm not sure I want Fannie and Freddie running health care. The government has not been very efficient or very effective in running pretty much anything that I've seen. However, healthcare costs are extraordinary right now. They're growing at 2.8% per annum over inflation. They can cover about 30% of the GDP if this goes unchecked in 10 to 20 years. And you also have 15% of the populace not getting insured. So how do you handle that? You can either do that through increasing taxes, such as recovering the $250 billion on the government exclusion on taxes for employee insurance benefit plans. You can do it through reducing inefficiencies or fraud, or through IT, through medical liability reform, through the $60 billion that's spent on fraud per year. And finally, you can do it by changing the quality of care through either price reductions or rationing. There's only three ways: reduce inefficiencies and fraud, increase taxes, or change the price quality construct at the end.
I think there's actually this alternative that the president is pushing, that Daschle talked about earlier on TV, the president discussed again last night in his town hall meeting, which is this public option. I think in the end, that is probably the most important point of what is being pushed forward. If you're talking about true health reform or overhauling the system, everything else I think is sort of on the margin. And I think as we come down to this debate in the next few weeks, the issue of whether there's a real public option, and that is a public plan that people can opt into that would compete against the existing health insurance plans. And the reason that has some logic, and I'm not sure I'm for it or whether it's actually going to work, is that through that plan you could institute all sorts of kinds of reforms on access and cost. You could require that doctors and hospitals behave a certain way. And people like Dr. Glassman said, well, this will lead to rationing. And, of course, the use of the word rationing is a bit of a scare tactic. I'm not sure exactly what it means. But clearly that public plan is going to be the debate over the next few weeks.
Dr. Glassman, clearly as a doctor, your concern is about quality. But how do you address this issue of overuse in the system?
Well, I think there are market-oriented means to do so as well. If you increase copays, that's a demand mechanism. The total health care costs go down 2% for every 10% increase in copays. Through managed care and through things like capitation and supply mechanisms, through market-oriented means, that has been done as well. A public plan, if it happens, will clearly be almost a monopsony. You'll have a single-payer system that will have tremendous power through capital stability and through an ability to dictate prices. If you dictate prices, you run the risk of having problems with healthcare delivery through either the service portion of it or through innovation and in drugs and devices and diagnostics. That is, to me, that is the major issue. Major issues is, do we want government boards and commissions and all these sort of advisory stuff?
Don't we already have sort of that happening with Medicare and Medicaid? Medicare really on a national level. And all the studies I see and the discussions that people have is that Medicare works. If you have an elderly parent or relative, you know that Medicare works, and it does it in a more efficient way than it doesn't have the administrative costs, doesn't have the for-profit requirements that a lot of publicly traded insurance companies have. And so it's a bit of a canard to say that this, you know, that
Medicare is insolvent right now, so I'm not sure Medicare is working so well. And I think we are really at
Okay, Dr. Glassman, you know, I just want to have you hold on to that thought for a second. We're going to take a quick commercial break. Come back to our conversation with Dr. Robert Glassman, Bloomberg managing editor, Mike Waldholtz. We're talking about health care, and we'll also have some news for you on what the former CEO of IBM had to say. We're talking about Lou Gerstner. He's currently the chairman of Carlyle. He had some interesting comments to make on executive compensation and taxing stock profits. Stay tuned for that. We're back now with Dr. Robert Glassman, private equity partner at OrbiMed Advisors, and Bloomberg managing editor Mike Waldholtz. We are having our own healthcare debate here. Dr. Glassman, you were just talking about how you don't want to see government in the business of healthcare. Mike was saying that government is in the business of healthcare. But let me ask you this question to try and provoke a little more of a response from you. What's wrong, for example, people bring up the situation in Canada. There's still innovation taking place there. There's still quality healthcare delivery, and it's being delivered to everybody. Why couldn't we do something like that here?
Well, first of all, on the Medicare question, the issue is that it's insolvent and it's only 15% of the healthcare system today. So if you go to Canada, where 70% is public and 30% is private, you have a different conundrum. There's major issues with rationing of care. If you need a hip transplant in Canada, you have to wait 6 months. If you're over 65. If you want to get a breast biopsy and you're worried, you want to get that answer next week because you want to know if you have cancer or not, you have to wait an average of 4 weeks. So, you know, the question is, do Americans want that sort of care? And that's not even a full single-payer system. There is private practitioners in Canada. And I know, you know, many people in Canada that once they get ill and they want to get taken care of quickly, some of them come over to the United States. So there still is a two-level system.
Well, that's true, but so... Let's say America wants what Dr. Glassman is describing. Can we afford it?
Well, I think the folks who are arguing against the public plan bring up a bit of a straw man, because that's not what Daschle was talking about. It's not what Obama's talking about. They're talking about a public plan that would behave much like our insurance plans, except that it would be open to people who aren't insured right now. It might have lower cost premiums. It would be open to employers if they want to offer it to their employees. It would not be fully subsidized like Medicare, although it clearly would be partly subsidized. I would ask Dr. Glassman, as I ask others who argue against this, what's the solution then? How do you deal with access for the 46 million uninsured, and how do you deal with cost if you don't have a competing plan like this?
Well, first of all, society has to make a decision as to where they want to go with health care. Do they want Ford Taurus for everybody, or do they want the ability to have better health care and innovation through market-oriented means? That's a major societal question. Innovation is going to be crushed. You said about innovation in Canada. Most of the major innovation that comes out in the world today in biotechnology is through the United States. 82% of biotech R&D revenues through the United States.
Dr. Glassman, I'm afraid we have to end it there. Mike, thank you so very much. It's Mike Waldholtz, Bloomberg managing editor. We've been having our own healthcare debate.